They're already running off overseas. You know, we're trying to run the rest of them overseas. I vote no to both of them. Thank you.
No, not that lucky. Okay, Mr. Fincher, you'll start out. As a healthcare worker, I see the strain Tennessee Care places on the system. What changes, if any, would you do to change TN
Well, we've got a bigger issue here. And as a U.S. Congressman, I'm going to be faced with Obamacare. And Dr. Rowe a few minutes ago talked about, I think what we're missing in this country, and this really became clear to me back early in the campaign, is I went around to Humphreys County, to Houston County, to Montgomery County, to Madison. I'm a farmer, folks, and I can tell you all you want to know about farming, Mr. Burke. Maybe some bad advice sometimes, but I can tell you, I can give you advice. We just passed a 2,500 plus page bill. And as Dr. Rose said, didn't ask the doctors to help write it. What we're missing in this country is we're not listening to the experts. I meet with doctors all the time, and they say, Stephen, there are things wrong with the healthcare industry, but a government takeover of healthcare? Please. What about Fannie Mae and Freddie Mac? What about the education system that's in just terrible shape? What we've got to do is listen to the experts. And the experts say we can do things like let insurance companies compete across state lines, health safety accounts, letting you move your insurance from when you move from employer to employer, move your insurance. Things like that will help get us back on the right road. But as a U.S. Congressman, I won't be dealing with TN as much, but probably at the state level, it's probably not much different. It's full of fraud and abuse. But we need to get it back to the people that can control it. More private sector, less government, less bureaucracy. This is a pattern that holds true no matter what facet of government you're talking about. And it's the same in healthcare. We've got to get it back out of the federal government's hands as much as we can, because they clearly don't know what they're doing. Thank you.
Healthcare. What a wash. You know, we get these questionnaires when we run for federal office. Everybody sends you these questionnaires and wants you to answer. If someone won't
hold the mic up.
Oh, sorry about that. I'm not used to holding mics. I'm not a politician. They said, do you think we ought to repeal Obamacare? Well, my first response was, come on, everybody knows we got to repeal it. But I started looking into the Constitution, and I realized, well, you know, we don't really need to rush to repeal Obamacare. Because, you see, according to the Constitution, it's illegal. It's illegal. So, now, if the U.S. Supreme Court does not hear this fast enough, because believe me, when it gets to the U.S. Supreme Court, it's going to be thrown out. I mean, you can't file, it's crazy. But I would have filed it under not just the Commerce Clause, but under the direct tax clause and also the allocation clause. Now, the reason why I would have done that is because, as you see, now that they're saying it's a tax, now they're having to redirect everything. You see? Had they went ahead and filed it under both clauses of the Constitution, they would have had it covered. But as far as TN, I'm going to tell you a quick story.
30 seconds.
A quick story about TN fraud. I had a lady who runs one of these Weight Watchers programs, which TN, by the way, covers. And she had people come in, she said, we used to have to develop programs for them to lose weight, you know, to get healthy. And then they said, well, we don't have to do that anymore. And then she said, what it wound up being is when people would bring their children there, which they take from the children too, bring their children there and leave.